Welcome to How to Solve Poverty. Today's question: what is limited access to basic services? How does it contribute to poverty? To find out, let's dive into today's lesson.
Explain succinctly what the concept of limited access to basic services is from first principles.
Limited access to basic services refers to a situation where individuals or communities face significant barriers in obtaining essential services necessary for a decent standard of living. These services encompass fundamental human needs such as clean water, sanitation, healthcare, education, and housing. When people lack adequate access to these services, it hinders their ability to lead healthy, secure, and fulfilling lives.
Why is limited access to basic services a problem that causes poverty?
Without access to healthcare, clean water, and sanitation, individuals are more susceptible to diseases and health issues, leading to increased medical expenses, reduced productivity, and overall financial strain. Insufficient access to quality education can hinder individuals from acquiring the necessary skills and knowledge to escape poverty and access better economic opportunities. Lack of affordable and adequate housing options can lead to homelessness or living in precarious conditions, perpetuating a cycle of poverty. Limited access to basic services can result in decreased productivity and workforce participation, further reducing income earning potential.
Why is limited access to basic services important to address? What's at stake if we don't address it?
Ensuring access to essential services empowers individuals to improve their living conditions, access education, and lead healthier lives, breaking the cycle of poverty. Access to basic services is fundamental for human development and well-being, enabling individuals to reach their full potential and contribute to society. Addressing basic service disparities is integral to achieving sustainable development goals, promoting social equity, and reducing inequality. Insufficient access to basic services can lead to social unrest, protests, and increased social tensions, jeopardizing overall social stability.
How might we eliminate or mitigate the problems of limited access to basic services?
Governments should prioritize investing in healthcare, education, water, sanitation, and housing infrastructure to ensure equitable access to these services. Establishing social safety net programs can provide financial assistance and support to vulnerable populations facing limited access to basic services. Collaboration between governments, private organizations, and NGOs can leverage resources and expertise to address service gaps effectively. Engaging with communities and involving them in decision-making processes is crucial for identifying local needs and designing appropriate solutions.
Right now, you are speaking to passionate students who want to solve problems like these. What top 3 skills should they study in order to do so?
Understanding public policy, analyzing its impact on basic service provision, and advocating for evidence-based policy changes are essential skills for driving systemic improvements. Being able to design, implement, and manage projects that address specific service gaps is crucial for delivering tangible improvements in access to basic services. Understanding community needs, conducting social impact assessments, and ensuring community participation are key for tailoring solutions to local contexts and fostering sustainable change.
Thank you so much for your time and attention.
If you want to learn the skills to solve this global challenge, join us for free at Plato University for exclusive content, extra resources, and actionable exercises with every lesson.